My name is Dr. Stephanie Higashi, and I'm the CEO and founder of Health at Last, and also working with fertility pathways. And today we have the honor to have Kelly Chick, who is a physical therapist and also the founder of Health at Last Catch Can, all the way out from Alaska. So, Kelly, I wanted to go over today just some questions that maybe couples have or women have specifically about fertility. Some topics that I get asked in those private rooms with patients of like, hey, how am I going to get pregnant if I have back pain and it's painful to have sex? And so I wanted to go over what things you found to be able to help couples, whether it be male or females, just first to just make sure their body isn't in pain.
Sure. Thanks for having me. It's really great to be here. I think common sense prevails, across the board for a lot of health issues, but sometimes we just need a little help just thinking about those specific things. And like any, healthy function in the body, you want to have health that is going to support that. So your general exercise, getting good circulation, being active, keeping your flexibility in good state. I mean, just because sex is exercise, let's face it.
That's right.
And so you want to be fit for the task. And so that can be different things for different people, depending on what's going on with your body in particular. I guess I'll just start with that and see where you want to take it.
No, I think that's fantastic. And, just like you said, it's like a sport or an activity. And we always tell patients, like, you should be doing activity in a pain free range of motion. So, maybe what we do is try different positions. Like maybe if it's not painful to be on your side, or maybe it's not painful to be in a doggy style position, or, whatever that could be. But I just want to like emphasize that there's definitely ways, but we find what positions or what angles could it be where it's pain free while you're healing, and then do physical therapy to actually heal whatever may be causing that pain. And you're right, whether it be from doing push ups to squats to stretches, and having cardiovascular health. So I think that's really,
Yeah.
really great. I really love that. Another fact that we learned recently too was that KY jelly and human saliva is actually a spermicide. So sometimes people will think like, okay, I'm going to use this to help, but it can actually act as a spermicide during fertility. So I thought that was
Hmm.
a very good thing of like, I wish everybody knew that fact, right? So I know a lot of the people that have been experiencing infertility, and we've seen it in the marketplace where they have some sort of hormonal dysregulation, particularly in the
Mhm.
female body. Sometimes it's because of insulin resistance, meaning they've gained weight or they're pre diabetic or even diabetic. Maybe their body mass index is too high, and this over amount of estrogen. And, if people are eating a lot of processed foods or overweight. And so I know that it can kind of compound. Like if you're in
Mhm.
you don't exercise. And then if you don't exercise, you gain more weight. So tell me how you've helped patients with physical therapy to get them in good shape so they can exercise and not be in pain.
Yeah. Okay. That's a lot right there. To anybody that's in pain isn't going to feel up to doing their normal activities. So I think, any modifications that are needed, it would start with really good communication with your partner so that it can be, mutual for both parties, to have a positive experience there. In terms of being ready and able to move from injury into health
Yeah,
is what I think you're asking.
that's right.
If you've had a surgery, again, modifications, there's a lot of different positions you can be in. Modifications are really the key to that. And if you can't kneel because you have a knee injury, then you're gonna, be in sitting position or on your back if you're a female. So there's plenty that you can do to make modifications.
I love that. And so one of the things that I noticed at Health at Last Catch a Can is like example, if somebody has injured their knees and they can't necessarily walk to get good cardiovascular health to burn calories, because it is a bit of a calorie in, calorie out. Like you have a hand bike, so people could just be like literally bicycling their arms, burning calories to help with some of that burning of fat to be able to be
Oh, I see.
healthy and lose weight, right? And I know that you have elliptical machines or bikes or different things that can actually help, or even if they're using a medicine ball with their upper body. So, what we do is like make
Yeah.
sure we can do exercises in a pain free range to be able to burn the calories needed to lose weight, to have an ideal body, so that the body's in its best shape and that you can continue to increase strength, walking, exercising, because really,
Oh,
right, because if people are having this polycystic ovary disease, or they're having diabetes, or they're having obesity issues, or body mass index issues, which can really affect fertility, having a physical therapy clinic and a place like Health at Last that integrates it to have you get out of pain so you can exercise, I think is really a great thing.
yeah, and getting started, I mean, anytime you're dealing with some significant comorbidities that people don't necessarily associate it with infertility,
Yeah.
but when you're looking at the big picture, just getting moving is the start. So finding activities that are doable, that are tolerated is a good start, but it is a combination of some aerobic and then adding in flexibility for arms, legs, back, hips, especially, and then pulling in core stabilization, making sure that your mobility and your function isn't setting you up for another injury. You need to have that good core. And so we emphasize core through even the arm bike and the elliptical. If you're on the elliptical or even on the treadmill, I'm always talking core.
That makes a lot of sense. And so I know some women have underlying conditions, heavy bleeding, fibroids, polycystic ovary, cysts, and a lot of these things, have been found in some literature that it can be related to, again, increased fat, which is increased estrogen. Also, there's some articles that show that, processed foods can kind of contribute to it. I know personally, I've treated some women where they had massive cysts in their breast. And I completely changed their diet where I got rid of chocolate, which has a caffeine effect and has caffeine in it. I got rid of caffeine for them. I had them get rid of potato chips and processed meat, and they completely went away. So we healed the gut, and by healing the gut, these little ruptures of cysts just went away. And I
Yeah.
think that these little cysts that occur, it's a chronic inflammation or the
Yep.
gut and body in itself. So, are there things that you do to increase circulation or help with like heavy cramp period pain, or, just these kind of issues with fibroids that you've done before in physical therapy?
I would start the way I approach most things is starting with always where they're at, but getting the mobility going and getting the cardiovascular piece in place and having them do what they can do. They have to make the association to what's happening on the micro with the macro, if you will. And that can be a piece of education to show them how they, when they get physically fit and get their circulation going, that they're actually helping their hormones and they're helping their endocrine system. I think teaching people how to handle their day, looking at their stress, looking at the depletions that happen, even setting good boundaries. I mean, protect your time, create time for your self care.
Yeah.
It's really important that people take it seriously. If they're not, if you're going to create a life in your body,
Yeah.
you need to have a life that it's going to be able to nurture it. So even before you get pregnant, you want to be thinking along that line as what would it take? So it is, what's your nutrition? What's your level of activity fitness? What is your strength? What's your flexibility? You want to be in shape for it.
You're right, and it's true. Sometimes it's like it's a whole other job for someone to get fertile. If they're like, "Hey, I'm having sex multiple times. I have to shower. I have to change. I have to have time. Plus, I have to do my job." And you just get so busy, then it's like, "Okay, when do I have time for me?" And so that's one of the
Mhm.
great things with Health at Last is we're like, just come in, come get a massage, get some acupuncture, get some physical therapy. See one of the medical providers or nurse practitioners, and really integrating the care and just taking that time for you, and I think
Yeah.
really increasing the circulation helps.
Yeah.
Another thing is, I've heard this and I wanted to see what you thought is, read an article that said that just by going for a 20-30 minute walk is equivalent to like two antidepressants. And, just the
Mhm.
vitamin D and being outside and the exchange of oxygen, it's like super simple, but it's something that
Right.
could really have a good benefit on the person's overall outlook and health
Yeah.
in general.
Yeah. I'll share one story with you. My My twin sister, when she got married, she was trying to get pregnant, couldn't get pregnant, couldn't get pregnant, and was working a fairly stressful job. And she was actually teaching high school, and she ended up 7 years into marriage, shifting gears and going into the university culture, working, at a different level within academia and moving into more of an office role, not as a professor. And that job switch alone turned it for her, and it helped her fertility. She got pregnant like within a month of having, made that shift. And I've often thought, what are the things that we're not paying attention to? And I could tell you that it was stressful for her. But what
Yeah.
are the things that we're not paying attention to that we need to if it's going to be a priority? Because I think stress can be a major factor for people, and being able to identify it, to make the necessary steps to really create that peaceful environment in your body and your microbiome makes a big difference for people.
You're totally right. And I think, like, people understand there's like a sympathetic and parasympathetic nervous system. So it's like
Hmm.
sympathetic is like fight or flight, we're getting ready, panic mode, getting attacked or something. And then parasympathetic is more for like relaxation, sex, these types of things. And it's like we have to like upregulate the parasympathetic nervous system and downregulate the sympathetic nervous system. So I think like your sister changing jobs, it's like, okay, let's calm down the sympathetic nervous system and then
Yep.
being more relaxed and taking more time for yourself. Those are really important things that maybe get overlooked in healthcare, or maybe a doctor doesn't have time to sit there and talk to you to say, okay, what does your day look like? Like, how much
Right.
time are you spending with you, for you, whether it's taking a bath, going for a walk, going to physical therapy, getting a massage, getting acupuncture, getting chiropractic? Like, how much are you just maybe going to a museum, reading a book? Like,
Yeah.
what are you doing for just you? So I think that's really, really good. Okay.
Yeah.
Well,
Can I
what?
add one other thing?
Yeah, for sure.
Yeah, I mean, as a physical therapist, the idea is do more, work harder. And I think to your point, it's really about that balance between the two. Is it's good to push, and you also need to rest. And if you're going to do more, which is fantastic, you want to be sure that you're not getting into like a chronic depletion, because some people are just pushed so hard. If I could only do this, and the stress and the type A, I if I do everything right, why isn't working out for me? But it's really a balance, and your body needs to be able to flex and go between that sympathetic parasympathetic response. And so it is just as important that you can downregulate. And for us here at Health at Last Ketchikan, because we have provide the craniosacral therapy aspect and massage to care, I mean, those are things that will help with that. We've got the heart exercise, and then we've got the ability to help the autonomic nervous system rebalance and downregulate. And that can be a real gain for people that only live in that intense place. And like, why can't I get pregnant? Why can't I get pregnant? And it's like, okay, sometimes less is actually more. And I think that's
Yeah.
the point I wanted to make.
I love that. That's beautiful. The body has to recover. We can push it as much as we want, and you got to push it to gain its strength. But really, that amount of rest and recovery is
Hmm.
just as important. And, some of the things that, like, again, I just wish everybody knew, but it's not common knowledge is so, for example, sometimes women, they're ovulating. They're like, okay, I have to have sex now. Come on, we got to do this. Da, da, da. And they have all this anxiety about it, right? And
Hmm.
or like, "Oh, we're gonna have sex 3 times a day," Fascinatingly, it's like the less times you have sex, the more concentration of sperm there is. The more frequent you have sex, there's less sperm, but it has greater motility. So it's like the more often you're having sex, it's like the more motility there is in the sperm, but there's less concentration. So again, it's
Hmm.
just what you said. Sometimes less is more.
Hmm.
So most OB gens will say, well, maybe every other day, just so it's kind of a balance between the concentration and that, and just to like let your body recover, right? So
Yeah.
I think it's a really good point. And, what I've noticed is that sometimes people say that they'll have difficulty time sleeping. And that's one of the biggest things we go over as providers is like, let's
Uh,
go over your sleep, let's go over your sleep habits. And people might know that physical therapists also go over activities of daily living,
yep.
neuromuscular reeducation. And one of the key things we always ask is like, okay, how many hours of sleep are you getting? And
Yeah,
sometimes, they're like, oh, I go to bed at 11 or 12 and I wake up at like a couple times a night and then I get up and I go for a run. I drink my coffee and it's just like go, 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 go. And it's like, okay, maybe go to bed earlier, wake up a little bit later, take a nap during the day if you need to. Like
right.
all these things that the body's replenished and has the strength that it would need to make an entire human. It's like
Yeah,
big,
yeah,
right?
yeah. You have enough sleepless nights later. Get your sleep now.
Yeah, that's right.
Yeah.
And so, one of the things and why at Health at Last we also have acupuncture is because acupuncture has a lot of specific things of like which organs are recovering during which hour of sleep at night.
Hmm.
So, for example, a lot of hormone regulation is actually through the liver and processing toxins. And I have a lot of women that ask me this. They're like, can't I still drink wine? Or I like to just end the night with some wine. But they don't realize that wine is alcohol. It's a very simple sugar. It's like two carbons, an oxygen, and a hydrogen molecule. And so it's kind of like if you ever been to a bar and they put alcohol to a flame, it's like poof, it like lights up immediately. Well, that same thing happens inside your body. So once your body starts metabolizing, it's like you have all this energy. So if you're trying to go
Right.
to sleep and rest, it's like all of a sudden you have this sugar from this alcohol that's going to make it where your body's going to be awake to some degree. Or
Yeah.
if you just drink so much you go unconscious, well, now you're just putting toxins in your body. But here's the other thing I tell people is like, if you want to lose weight, the liver is what processes fat. And if it has two choices to process a toxin like alcohol, or to process fat, it has to pick the poison of alcohol. It's not going to do fat. So it's really hard to lose weight if you're drinking alcohol. And I know that's really hard to
Hmm.
say. And I always tell
Hmm.
patients, I'm always going to tell you what is true and you need to hear, not what you want to hear. But that's what I would say is if you are really wanting to get pregnant, if you're really wanting to control your weight and be ideal, I would definitely eliminate any and all alcohol, not to mention the fetal alcoholism. And like anytime you could get pregnant, you don't want to
100%.
be like, oh, I was pregnant for a month and I didn't know and I was schlucking them down every night, So I think
Yeah.
that's an important topic as well.
Well, and the same thing applies to smoking cigarettes or smoking any other,
Yeah.
uh, you
Marijuana,
know,
that's legal in California. Yeah.
legal, but not great for the baby,
Right.
and
Yes.
so, why be doing that when you're trying to get pregnant? I mean, I
Yes.
just don't know why. Why would you? I mean, if
That's
you're
right.
really serious, if fertility is really your goal,
Yeah.
then it makes sense that you're making your body a place where it would welcome
I
that
love that point.
feeling.
We would never tell someone not to be on a medication, but I would say if you're taking a medication that you could have help and assistance, which we do have assistance to help people with symptoms, whether someone's depressed and we can help give them amino acid formularies for that, or going for walks, or getting extra vitamin D or different B
Yeah.
complex, instead of being pregnant on a medication that could affect the baby. I think that that's going to be a more ideal thing. But it's like we know that you're probably doing a drug or drinking or doing something to solve some problem. So if we can help find what that issue is and help sort that, then I think
Yeah.
it really helps do it. Because, of course, people that smoke are like, I want to stop smoking. And I've stopping smoking is as difficult as heroin, is what I've been told. And so, you know, there's tips though. There's acupuncture, cessation smoking points. There's exercises you can do to stop smoking. So I guess what we're trying to articulate is if you're doing something to solve a problem, let's just attack the problem. And then that way you don't have to do the thing to solve the problem, right? I love that. So then, all right, so let's say the person's in perfect shape. They no longer have pain. They're having sex. The egg comes down. It meets the sperm. It implants. They're like, I'm pregnant. So what are some of the things that you do with pregnant patients as far as physical therapy and helping them
Mm.
with like, their posture, their body, the changes that they're going through?
Yeah, that's a great question. So there's plenty of exercises that can be done to really help the body prepare for the move. It's the relaxation of the pelvic floor. It's getting some biofeedback in that area, keeping the flexibility, but it's also keeping your core strong because a lot of people develop back pain
Yeah,
during their pregnancy, and understanding positions that you can be lying in, the how can I get on my stomach when I am pregnant, when I don't really want to be lying on my back because I don't want to put pressure on those blood vessels,
right.
and helping women find those alternate positions, rest positions. Physical therapy can be really helpful in overcoming some of those painful periods that happen just as the body's growing. Different people have different bodies to start with, and sometimes carrying the baby really can throw a few things off if you had scoliosis ahead of that, if you're someone that has a certain body type and you're carrying a really heavy baby, and so, learning different things. Aquatic therapy can be very, very helpful to people with the swelling in your legs, that develops. Just having someone to work with you on making sure that you can do as much as possible for as long as possible is a really great tool that physical therapy can offer.
Totally. Some of the most common things I see with pregnant women is, they'll say they're getting carpal tunnel, which this is the carpal tunnel. Carpal means the hand and tunnel was where the nerve comes. And they'll be like,
Yep.
I have pain or tingling numbness. Or they'll say that they, like you said, swelling in their legs, or they'll get back pain. So a couple different things about that. One is like as the breasts get larger and the belly gets larger, it pulls you forward. And the more that it's forward, the more it pulls on the lower back. Then also there's a change of fluid distribution and retention of fluid sometimes because of the hormonal changes, so it causes a little bit of retention of fluid. So sometimes if you've had like an old injury, now that there's not enough room because there's like extra fat, extra water, extra fluid, it will resurface some of those injuries, right? So it's one thing, like you said, is hey, let's optimize that before you're really getting pregnant. But also, number two, on the earliest parts of pregnancy, it's really great to fix it then. Because
Yeah.
when you're pregnant, you release a hormone called relaxin. So it's easier to get things back in the right place. I can tell you as a chiropractor, much easier to adjust somebody. We use like maybe 10% of force that we would normally use. But
Yep.
also it's the swelling. And so one of the things that I've seen, one is sometimes fluid retention is because you're not drinking enough fluid. That's one of the most common things I see because they're like, I'm already so swollen, I'm not going to drink water. I'm like, your body's retaining water because you're not giving it water. So it's
Yeah.
like if we give more fluid, then the body will stop retaining it, right? We can also work with sodium and potassium to help regulate some of that fluid retention and cell salts. So we can do a lot of things with it depending on what's happening with you. But I think with like a massage and physical
Hmm.
therapy, what are the things that can help with like leg swelling that you've seen?
With leg swelling, I mean, some lymphatic drainage would be very beneficial for that. Sometimes there's support hose that they can get, whether it's over the counter or whether it's really significant. Usually it's something simple that you can get to kind of help. And then, muscle work, can help getting the squeeze to get things back up. I was thinking actually of another story. A woman that came to see me who was pregnant for like her she'd had a child earlier and who is now like 7 or 8 years old, but early in her pregnancy when she was still very elastic, she ended up having a strain
Hmm.
and in her shoulder and her neck from breastfeeding all night long, and it never really, went away, and she struggled with it and treated her. So over a period of time, it got better so much. But when she got pregnant again, she's like, opportunity, because as she went through the pregnancy, her body went through that same period of relaxing. And we were able to actually finish the correction working with her body's natural systems to actually finish the job from
Wow.
round one to get her, because her body just wasn't going to go there wherever she needed to go, flexibility wise or otherwise. She didn't have it. So we were able to get that worked out
Wow. It
on
is
round
really a
two.
great time to get treated while somebody's pregnant just because they do have all those relaxin hormones. Things are easier to move and repair and
Very much
remodel.
so.
Yeah, so I think that's fantastic. One thing that I think a lot of people don't like to talk about and aren't really talking about is miscarriages. And I know it's like
Mm.
documented that maybe 10 to 20% of women have miscarriages, but they said really it's probably about 30 to 50% of conceptions, meaning like they don't even know they're pregnant
Yeah, they were never viable.
or they never talk about it, right? They never even say about it. And so one of the things, a lot of that happens during the first trimester, but that people don't realize is that fertility specialists actually think it's a good indication that someone has actually gotten pregnant because they're like, well, at least that
Hmm.
means the egg can come down. It means it's meeting with the sperm, that there's sperm that work and it's implanting. So they're kind of like, this is actually a good sign. It's not a
Yeah.
bad sign. It means that there's less obstacles to actually overcome because when the fertility specialists are looking at all the different things, they're like, Are the fallopian tubes closed? Are there blockages? Is there an
Right.
inability to implant? Is there not enough sperm? Like they're trying to think of all these different
Totally.
possibilities. So knowing that it can be a common thing, and obviously there's this wrenching of hormones going up and then crashing down. How have you found that, physical therapy can just help reset the hormones, in the body when it's gone from like spike of hormones to be pregnant and then bam, crash down, not pregnant, and all the emotional roller coaster and how the body holds emotions? Like, what have you found to be effective to really get that order being put in by getting physical therapy after something like that?
Yeah, I mean, it really has to do with establishing that self-care routine and that discipline. We can help as physical therapists to provide some accountability and instruction to really tailor it to the needs of what their deficits are, if it's a knee issue or a hip issue, and making sure that they can progress comfortably back into, normal activity. But it's working with them to be able to do that. It's kind of like you have to do it. And so sometimes they need the inspiration. We equip, empower, and encourage our
Mm-hmm.
patients to get out of the rut.
Yeah.
If you're in a really low point, we can pick you up right where you're at, but getting active again and
Mm,
having somebody that really understands what that progression needs to look like for you to help you along your way. And you gotta get the discipline to do it. Energy level can be low, so you start with where it's at, but you have the attendance. You got to develop like the muscle memory, if you will, to
yeah.
get things rolling again. And the endorphins, then they start to kick in, and you can start to shift the endocrine system and get things moving in the proper manner.
I think that's great, and it's challenging, like if you just like, "Oh my god, I'm gonna have a baby," and then all of a sudden like, "I just lost a baby," it's the easiest thing is to crawl up in a little ball in your closet and cry or in your bed, and I think that like, "Okay, I have to go see the physical therapist, they're waiting for me," and, "Okay, I have to go get this massage, they're waiting for me," and it forces
Yep.
you to like get up and hopefully brush your teeth and come into the
Yep.
office. It does help you get through that. And it is one of the most, painful, difficult, not only of a loss of a life that was going to be, but also just for your body. It's very, very challenging and difficult. So I think having that to be like, okay, let's get back into a routine and have something that's going
Yep.
to force back in some normalcy and not just be curled up in a ball. I mean, fine, have it for as long as you need to, but then that'll get you through that process. So I really love that, the encouraging
Yeah.
and empowerment that you have.
Yeah.
Good. So, all right. So then once they're actually pregnant and we have them doing the things with, breathing and posture and all of these types of things, like how often do you usually recommend for somebody to come or that you've seen, the obstetric gynecologist recommend for someone to come in and get physical therapy while pregnant?
Typically, in order to really make changes, you want to see somebody at least twice a week.
Okay, good.
And if it's really an acute issue, then they really need a lot of help, then you could go 3 days a week. But most people can do stuff in between. And we're really there as a coach to handle anything that comes up and check in. But it'd be rare to be less than that.
Yeah, that makes sense.
Yeah.
Yeah,
Just helping them along.
we're the same. It's like, 2 to 3 times a week, get you in really good shape. If you're in actual pain, I've even had patients come once or twice a day because maybe we'll do some sort of treatment in the morning. And then if it
Yep.
starts creeping up more pain in the afternoon, we'll do some different therapies like ultrasound, electric stim, light tissue work. So,
Yeah.
it's really something you can do as is needed to get you out of that situation. It's like, let's first get you out of pain, then let's get you feeling comfortable, then let's build strength because it's hard to
Yeah.
build strength if you're in pain. So,
Yep.
okay. And then now I know that there's this whole thing of diastasis recti or incontinence that happens with pregnancy or postpartum. So, what are some of the things that the profession and field of physical therapy can do for these types of things?
Depending on the physical therapist training, there is the potential to do some visceral manipulation on the area just to help things stay in alignment in the abdomen. Outside of that, you're looking at pelvic floor strengthening, some core strengthening, really teaching people how to engage their abdominal muscles in the right way so that
Mm,
it's not like a Valsalva bearing down pressure from the inside out. You want to have pressure from the outside in, kind of
oh,
tightening you up, pulling you in, getting that balance that you're needing. Yeah. I mean, there's
That's
ways to
brilliant.
teach people how to notice what's happening in their bodies so that they can correct any compensations they've been falling into.
I love that. One thing that's really interesting I get asked a lot is as people are really pregnant and sometimes the baby is in the wrong position or the baby hasn't dropped, they go, "How do you do? What do you do with that?" I know at Health at Last, I've been trained on what's called the Webster technique, which can actually help turn a breech baby. So I definitely
Hmm.
have that where we can do chiropractic manipulation. The other thing is we can do different adjustments. So it's like if the pelvis is misaligned, the baby might not drop because it's just sitting in a wrong position. So if we
Hmm.
have the woman's pelvis aligned, then the baby
Hmm.
should just be able to drop down very easily. So that's something that
Sure.
we do. And I'm sure with just even exercise and releasing and stretching tight areas, that could help with that.
Yep.
So now I've read that usually after a delivery, if it's vaginally, that you can start physical therapy usually after 2 to 6 weeks. And if it's a C
Hmm.
section, after about 6 to 8 weeks. So I just wanted to say, is that something you've seen or feel like is appropriate?
Yeah, that makes sense. You want the incision to heal enough that there isn't a risk of doing too much or tearing the incision, repair.
Yeah.
But really, I mean, if it's a natural birth, getting started sooner the better.
Yeah. That makes sense. And I know that there's in physical therapy they do scar treatment or scar therapy treatment or help with scars so that they're can heal appropriately because that tissue of a scar is different than what it was originally. What are
Right.
some of the things that you can do to help with that?
Well, a specially trained pelvic therapist can do some internal work if it's needed. And there's electric stimulation that can be either intravaginally or outside the vaginal canal. Those are some tools that we have for reteaching some of its biofeedback to help people understand, well, what muscle am I actually using there, and to get things back in shape for sure.
That's awesome. I know sometimes what we'll do is we'll do ultrasound over the scar when it's appropriate just to get the scar to start healing. And that's just sending a sound wave in to decrease some of the
Yeah.
inflammation and pump out some of the little blood things that are sitting there and just clear it up. And then after the scar becomes fully formed, we'll do what's called like a cross frictional massage along it so it doesn't create
Yep.
adhesions to the muscles below it. So
Yep.
there's a lot of things that, you just continue to do to just optimize that body, right?
Yep.
Then I think that the
And
most
one other thing that physical therapy will do, if I can add it, is cupping.
yes,
That's
cupping.
another great tool once the incision's healed well enough.
Totally, right? Yeah. Acupuncturists, physical therapists, even chiropractors, they all do that, which is really brilliant and
Uh-huh.
helpful. I think like my intention of why I'm helping do this program is like one, everybody loves babies, they're so dang cute. So that we want to have more people and, make the earth great. But also I want to have parents to be healthy and happy and they can enjoy their lives with their babies once they have them
Yeah.
because there's nothing more painful to see like a new mom or a new dad whose back or neck goes out or they're in too much pain to like lift up their baby or hold their baby or want to be with their baby. And I
Yeah.
think that if we can optimize the baby's parents to be in really good shape physically, mentally, emotionally, everything, then it's like they're going to enjoy that time of life that, like you said, they're going to have some sleepless nights. It's a long lifetime commitment,
Mhm.
and so that's our intention of why we want to help people with this. And
Yeah.
I'm hoping Health at Last bring all these different providers together in one place will make it super convenient for you to have the best healthcare providers answer any and all your questions available to help you and make it so you have everything you want to achieve. All right.
I
Well,
like it.
thank you for joining us, Kelly.
You're welcome.
Okay.
Bye.